Hello, I'm Dr. Anil Kumar Dharmapuram from KIMS Hospitals. I'm a pediatric cardiac surgeon here. We have a family from came to us some time ago from Nigeria. This kid is about 9 months old and was operated here for a complex cardiac surgery problem. So, the kid has got a problem called tetralogy. Okay, so this is a cyanotic heart disease, that is a blue baby syndrome. So in this problem, the blood going from the heart to the lungs is less because there is the valve which carries the tube and the valve which carry blood from the right heart to the lungs is entirely small. The entire tract is small. In addition, there is a big hole in the heart, between the lower chambers of the heart, called VST. The combination is called tetralogy. So here, the baby, what we did for the baby is a complete repair of the heart, that is repairing of the repair the hole and also reconstruct the outflow tract from the heart to the lungs with a new valve mechanism. So the baby's own valve, called pulmonary valve, was small, and the pulmonary artery, which is a tube which takes blood to the lungs from the heart, is small. So the valve of the baby is small and slightly thickened. It cannot be used as a normal flow of the blood from the heart to the lungs. So what we did, when we make a cut in that outflow tract and then enlarge it to make it bigger, if we just put a transalveolar patch or a single patch, the blood is going to leak from the pulmonary artery to the heart. That is called regurgitation. So to avoid this after operation, what we did a reconstruction of the tract with a artificial membrane, PTFE thin membrane called Gortex membrane. It's a very thin membrane, and what we do, we reconstruct it. We use it for reconstruction of and to help the native valve to make a valve mechanism. The native valve of the baby, which is small, is repaired by new technique called delamination. In this technique, the valve which is thick is thinned out, is thin, and the mobility of the valve is increased. When we do this delamination, the valve will lie in the posterior part of the outflow tract, and in the anterior part or in the front part of the outflow tract, we create this valve with a new membrane, PTFE membrane. So both the native valve, which is delaminated, and the artificial valve, which is reconstructed, make a valve ring which is competent. And this baby had very good operation, and there is no leak of the valve, leak of the pulmonary artery after operation. The baby is ready to go home. So in future, I expect as a surgeon that the cusps of the native valve of the baby, which was delaminated and repaired, to co-opt and to work in collision with the newly created valve cusp with the PTFE membrane, will grow with the baby. I mean, the native valve will grow with the baby's heart, and hopefully the baby should not require any more surgery for valve repair, for valve change in future when the baby becomes big. This is the new concept in tetralogy valve repair, which we have developed in our unit in KIMS hospitals here. Thank you.
Well, concerning the services of the hospital when we go here, it's actually top notch. Dr. Anil Kumar is a surgeon that, like a senior cardiologist that he is, I didn't expect him to be easily accessible. I was thinking that I was not going to see him probably until the day after the surgery, but we're always meeting him. He was always telling us, giving us feedback, telling us what he did. Even before he did the surgery, he told us the condition. He drew a diagram for us to explain the condition. And after the surgery, he explained exactly what he did, and we were surprised because I didn't expect that. I just expected him to tell us the surgery was successful, thank you, and we'll just go. But he sat down, explained to us, was always giving us feedback. He's easily accessible. I didn't expect that from him. And concerning the nurses, the housekeepers, the cleaners, the securities, the protocol, they were all at their best. They were very professional. Like when we go here, they were, we felt loved, we felt accepted. There was no discrimination because we are not Indians, but they didn't make us feel that way. We felt so accepted. Their services is so professional, top notch. The environment is very clean. The ambience is 100% fine. I mean, we are so impressed. At least we are happy that we got value for our money, and we thank God today that my baby is doing well. Even the scar, after some days I was surprised that the scar was totally dried and he was able to roll on the bed, play, and it's fine. And I didn't expect it to be that fast. I didn't expect it to be that neat. Even the scar is so clean, so neat. I mean, it didn't even show that he did a heart surgery. It's not obvious, and he's looking fine today. He's not looking like someone that did an open heart surgery. So we are very fine, and I thank God for Dr. Anil Kumar.